Hi everyone, good morning or good night, depends on your time zone. This is Ahmed 𝗙𝗚. Today, our topic of the webinar is about R1 mini kit file, which is a reciprocation file system by Fanta. I hope you will get benefit from this webinar because there will be a lot of information. I'll be honest with you, when I was asked by Fanta to do this webinar, I was a little bit skeptic because I'm not a big fan of reciprocation. So I had to do my research, and after my research, it changed my mind, and we will discover this in the next few minutes. So I'm Ahmed 𝗙𝗚. I'm a gold member of 𝗙𝗘𝗡 Endodontics. I'm based in Dubai, and I practice both in Dubai and Iraq. I have MSc from King's College London in endodontics. So let's have a quick review about endodontics before we jump to canal preparation or reciprocation. So according to the European Society of Endodontology, endodontics is anything related like the injuries, the anatomy, the diseases, health of dental pulp tissue and periradicular tissue. So we are not dealing only with the dental pulp tissue. The main disease we are facing is not pulpitis, rather than it's apical periodontitis, which is caused by infection. So our main goal from root canal treatment or endodontic treatment is to prevent or cure apical periodontitis. This is our main goal. Either we prevent the happening of apical periodontitis or it's already there and we need to cure it. And we can do that by two major steps. First, we need to eliminate the causative factor, which is the bacteria, from the root canal system. And then we need to seal the root canal system with a hermetic seal to prevent reinfection. Successful endodontic therapy, it depends on the removal. So this is how we eliminate bacteria. We need to remove vital, necrotic, remnant pulp tissue, dentine debris, microorganisms, toxins from the root canal system by what's so-called chemomechanical debridement. So what is chemomechanical debridement? It consists of two phases, which is first we need to use special instruments, which are files. We need to enlarge the root canal space, especially the apical portion, so that the irrigation solution can reach to the apical portion and disinfect and disrupt biofilm and make the disinfection of the root canal system. Majority of you may know that the root canal system, how we see it on X-rays, is only a small lines, and then we need to fill them with the white material to be white lines. We need to reach the apex, and this is our main goal. But in fact, no, this is what we are dealing with. Root canal system is a very complex three-dimensional system. So we need to disinfect. We need to remove all pulp tissue, either infected, inflamed, toxins, bacteria, debris from this root canal system by a thorough chemomechanical debridement. And then we need to seal it with a hermetic seal or three-dimensional obturation material. How we can do that? We need to enlarge the apical portion of the canal to a certain size so that the irrigation can reach and do disinfection. So again, this is the complexity of root canal system. This is an upper first molar. You can see how complex it is thanks to the new technologies, 3D imagings, and special softwares, that you can see the distobuccal canal just like a mesh. The mesial-buccal MB1 and MB2, they have many isthmuses and fissures between them. And also this is a lower molar. You can see that the mesial canals, they merge together at the apical portion. Now, the objective of preparation of root canal system is the prepared canal should include the original canal. We should preserve or maintain the apical constriction, and the canal should end in an apical narrowing, so the canal will be tapered from crown to apex. We can we can describe the root canal instrumentation just like using a drill. So when you use a drill to make a hole inside the wall, the drill will progress inside the wall. Then at some point, the drill stops, not stop from rotation, but it doesn't go any further. So what we do usually, we take out the drill. So we see the debris go out of the drill. And then when we go inside, we can see the drill can progress in drilling. So it's about emptying the fluids from the debris. And you know, the drill consists of what we call blades, and between the blades, these are the depressions, what we call fluids. So when the drill cuts, there will be debris, and the debris will accumulate in the fluids. And when these fluids are filled, the drill will not cut. That's why we need to empty these debris. It's the same for root canal instrumentation or preparation. So when we using our files, a continuous rotation, they will stuck inside the canal. Why? Because of the fluids being filled with the debris. So that will lead to file separation, which is a nightmare for every dentist. Okay, and yeah, this is the nightmare, and I'm pretty sure it's happened to everyone, even the most experienced endodontists. They have file separation. Okay, usually the file separation happens due to either cyclic fatigue or torsional stress. And cyclic fatigue, like this one, this is what's cyclic fatigue, and this is what's torsional stress. So this is the difference, and both of them may cause file separation for many factors. Okay. Now, one of the most famous engine-based rotary files was the 𝗏𝗏𝗃𝗏. And you can see that because of these things, we cannot use a single file in rotary movement. Why? Because we'll have file separation. This is why it's a progressive enlargement. So in 𝗏𝗏𝗃𝗏, we had shaping files, and we follow the crown down technique. We first prepare or shape the coronal part of the canal, then the middle part by S1, then the apical part by S2, and we shape the canal. Then we will jump for or we go for finishing files. So we have F1. You may stop at F1 or F2 or F3. You may sound it's easy, but it's not easy, because whenever you use any file system, you have to follow the recommendation by the manufacturer. So we know that root canal treatment is a complex procedure, and when you are using 𝗏𝗏𝗃𝗏 with these instructions, it makes it more complicated. So this is why companies, they started to make many files, like they're different either in the cross section or many changes, but still they are progressive enlargement. They didn't use for rotation any single file endo. Okay, so then the scientists, they thought that the problem, we're getting file separation because of the movement. So why don't we change the movement? So in 2008, Prof. 𝗏𝗂𝗃𝗀𝗃, he introduced the idea or the concept of the reciprocation. When he used the F2 of file of 𝗏𝗏𝗃𝗏, which is 25, in reciprocation movements. So this technique would offer two major advantages. Single use of endodontic instruments would become more cost effective, and the elimination of possible prions and cross-contamination, because you're using less files. So the idea of reciprocation was to make the root canal preparation easier, or to use single file endo. For that reason, there was the evolution of wave 1 reciprocation system by Dentsply. Although it was 3 files, but it was single file endo. You don't use the 3 files. You use only 1 file to prepare the canal according to the width of the canal. So you have the small, primary, and large. Small is size 21, taper 6, and primary size 25, taper 8, and the large was size 40, taper 8. You can see that the taper is very big. Okay, we're talking about taper 8. And why they were doing this? So the reciprocation movement was not enough to make the file resistant to fracture. Okay, so I started using reciprocation because it was a revolution. I think in 2012 I started. So, but at that point you cannot use only the files because you need an endomotor that have that movement. So you have to purchase the endomotor. At that time, believe me, in 2012, it was very expensive. So from the first case, I was very happy. I got file separation. And I contacted the dealer. What's the problem? So the concept of reciprocation, the file will go back and forth, clockwise and counterclockwise. Main movement was counterclockwise and to up to 170 degree, then clockwise as a release or to empty the debris at 50 clockwise. So with the three times, you will have a complete circle. So again, I had file separation. So I contacted the dealer. What's the problem? I just got file separation. This is my first case. And he told me, did you use the path files? I said, what are the path files? He said, no, there are path files, which are rotary files you need to use before you use wave one. Those path files, size 13, 16, and 19, all taper to. So it was not a single file endo, unfortunately. So wave one failed to provide a single file endo use reciprocation. Then they tried to modify it. They introduced the ProGlider instead of path files, but still it's not a single file endo. And also wave one gold, they made a modification of wave one. They introduced wave one gold, better metallurgy, and also wave one glider, gold glider, which was also path file but a reciprocation. But again, why should I change? Why should I change from rotation to reciprocation? Why should I purchase an expensive endomotor? Because the idea was to use a single file endo. It's not a single file endo. Until VDW introduced the file system called Reciproc. And at that time, it was really a single file endo. You have also three files, all reciproc, but you don't use all of them. You use only one according to the width of the canal. I was a big fan, believe me, I was a big fan of that file system. At that point, I was used it a lot. It could open any canal. It was wow. But the problem, how come it doesn't fracture? Although they changed the cross section, make it S-shape, different metallurgy, but also the taper was taper. So imagine you are working in a tooth consists of dentine, which is brittle. You use only K file 10 to scout the canal, then immediately you jump to size 25 taper 8 without any path file and in reciprocation motion. So what was the issues in both file systems? I mean, whether wave one or reciproc, they're large taper, so they're very aggressive. We had, they were pushing debris in apical direction. So we had post-operative pain, sometimes swelling, and most importantly, crack generation. And that's what happened with me. After 3 years, 4 years, 5 years, review, I found many cases they got filled because of vertical root fracture, which is generated from root canal cracks. So that was the main issue of reciprocation. That's why I stopped using reciprocation since 2017, and I use only rotary file system, even though it's progressive, okay, but it's safe. I don't have debris to be pushed. I don't have cracks, which is the main issue was for me. So this is why I told you when I've been asked by Fanta to make a webinar about their new file system reciprocation. I was a little skeptic because I'm not a big fan of reciprocation. So now I'm just like you. I had to do my research and I found a lot of information because honestly, I stopped searching or reading anything about reciprocation because it was out of my mind. So the main issue is about a crack generation during with reciprocation files. But we had an interesting paper, okay, it's called, the title was The Lack of Causal Relationship Between Dentinal Microcracks and Root Canal Preparation with the Reciprocation System. So what they do, they use Reciproc, Wave 1, and BioRace, which is a rotary file to compare. And in this study, there was no causal relationship between dentinal microcrack formation and canal preparation procedures with Reciproc, Wave 1, and BioRace system. So it was the same. But I'll be honest with you, I will not count on this paper. Why? Because it was published by key opinion leaders of VDW. So I had to do my research. Let me just remove this one. So does rotary file make cracks, or the cracks only with reciprocation? So we need to look, because according to that paper, also the previous paper that I just showed you, also rotary files may make cracks. So this is an interesting paper, okay? Under the tested conditions and within the limitations of this paper, it may be concluded that the use of some rotary night-eye instruments could result in an increased chance of dental defects. So not only reciprocation files make dental defects or cracks, but also rotary files can make cracks. So another paper, okay, they compared, okay, many file systems. So they had 5 groups: unprepared teeth, and teeth prepared with manual files, teeth prepared with the ProTaper file system, teeth, which is rotary system, teeth prepared with the profile, which is also rotary system, and teeth prepared with System G, also rotary system, and 𝗚𝗵𝘃𝗧𝗔, also rotary system. So they compared many file system or rotary. They found that majority of them, they cause what? Cracks. And that was interesting. And if you see, the most file cause crack was ProTaper. Okay, you may say that the problem is because of its large size, large taper, as we mentioned. But if you can compare, if you see is in this diagram, that ProTaper, Profile, GT both finish in size 40 taper 6. They all have same taper and large size, but ProTaper was the interesting thing. They used the 𝗚𝗵𝘃𝗧𝗔, which is size 60, didn't cause any cracks. Why? We don't know. But if you notice that it was the only file, it was 0 taper. It didn't have any taper. So that one didn't cause any cracks. So now you may know, okay, from my conclude from this paper. So it's about the taper. Okay, large taper may cause more cracks. And if you compare ProTaper profile, so although they all cause cracks, but ProTaper was more. So maybe there is another issue, not only the taper. Okay, now I need to know which one causes more cracks, because now we know the rotary files also cause cracks. So which one causes more cracks? Reciprocation or rotation? So this is a very nice paper. They compared TF adaptive system with Wave 1 and Reciproc. So we know Reciproc is a reciprocation, Wave 1 reciprocation. TF adaptive, it's a rotary file system, but when it's subjected to a load, it becomes to reciprocate. When the load disappeared, it will go back to rotation. So TFA system causes less root microcracks. So although it causes cracks, but much less compared to Wave 1 and Reciproc. Okay, so now rotation, does rotation causes less number of cracks? Or so it's about the rotation or reciprocation, but we need to identify something. Reciproc and a Wave 1, they are single file system, but for the TFA, it's not a single file system, it's a progressive. So now, is it about the type of motion or about the number of files? So this is a good question. So we need to dig more about to check the number of files. Does it affect the crack generation or not? So in this paper, they compared 5 groups of teeth. So group number 1 was no preparation as a control. Group 2 hand files. Group 3 pro-taper universal rotary files. Group 4 one shape rotary file, which is single rotary file. So pro-taper is progressive enlargement. One shape is a single file, but rotary. Wave 1 single reciprocation. And look at this. The conclusion or the result of this study. Within the limitation of that study, mechanical instrumentation can be associated with the formation of dentinal microcracks and significantly higher crack formation in the apical third of root canals was observed after instrumentation with single file systems, regardless of motion type. So this is very astonishing because now in this paper, it's not about the type of motion. It's about the number of files because the highest one was rotary single file, just like rotary reciprocation file. So if you go back to history, the problem of reciproc at wave 1, was it because they were reciprocation or because of other factors? Because they were single file, they were very taper, aggressive. So maybe it's not about the type of motion. There is another paper, they compared pro-taper universal system, which is rotary multi-system. 𝗬𝗙𝗂𝗍𝗑, it is a reciprocation, also multi-file system, not single file system. And 𝗬𝗟𝗟𝗃𝗃, which is rotary single file system. So the null hypothesis may be the reciprocation, even if it's multi-file system, will produce more cracks. But if you look at the result, you will see that 𝗬𝗟𝗟𝗃𝗃, which is a single file rotary system, caused more crack than the reciprocation multi-file system. So now it's clear evident that crack generation develop more because of the number of the files more than the type of motion. Because even if you are using rotary single file endo, the incidence of crack generation is much more than using multi-file reciprocation. So these results are very astonishing. There is another paper compared the deformity in the canal. Okay, in a plastic, they made in these plastic models using wave 1, group 1, wave 1 with the path file before, and then only a single file without path file. And the result was the clinical modification seemed to be significantly reduced when previous glide path is performed by using a new wave nickel titanium single file system. So again, it's not about even with the wave 1, even with it's aggressive, but the deformity in the canal crack generation will happen more if you use it as a single file without the path file. Okay, even with the path file, it causes high number of cracks, to be honest with you, but that cracks is much less than using these files alone without any path file. Now, is there the design of the file? Does it have any effect of crack generation? If you go back to this, if we take a look on this paper, so they compared the crack generation. They brought both large and small canals. This is very important. And they prepared the canals 1 millimeter shorter than the working length and 1 millimeter longer than the working length. They used the wave 1 up to size 40 taper 8, pro taper universal up to F4, which is also size 40, TF up to 40 taper 4, and TF adaptive up to 50 taper 4. Okay, so what they have noticed that the crack generation is more, okay, in the wave 1 system. Okay, why? So mostly because of the, or maybe because of the, it's a stiff file, aggressive, the file design, we don't know. So let's take a look at another paper. Okay, they compared, okay, between many file systems. What they concluded, the stiffer file design generated higher stress concentrations in the apical root dentine during shaping of curved canals, which raises the risk of dentinal defects that may lead to apical root cracking. So, also the design of the file affects the crack generation. For that reason, okay, there is another consideration. How about the torque we are using this file? So this is very nice. In this paper, they compared the same file system, okay, same file system, which is wave 1, but according to the ProTaper Universal, which is a rotary file. We're not talking now about reciprocation. So according to the recommendation of the manufacturer, you have a range of torque you can be used for these files. So you have the minimum value and higher value of torque. So if you can see in this table, like SX high torque, you can use at 4, and low torque and use at 3, and vice versa. So they made two groups, one group using ProTaper Universal with minimum torque, and the other group also same file but with the maximum torque recommended. And the conclusion, within the limitation of the study, the instrumentation of root canals with the ProTaper Universal instrument used as high torque setting caused more crack formation in root canal dentine compared to low. So whenever the high torque, whenever we have crack generation, regardless the motion of the file. Okay. How about not only the design, let's talk about the type of NiTi. Okay, the treatment, we already talked about the type, okay, which is stiffer or not. How about the treatment of alloy? For this paper, okay, they compared many instruments, okay. So the ProTaper Next and TF Adaptive, okay, both are rotary, produce significantly less cracks than ProTaper Universal and Wave 1 system. So this is very nice, okay, this is very nice, because the ProTaper Next, which is rotary, okay, produce less than ProTaper Universal. Why? Because they changed not only the file design with the ProTaper, but also they changed the metallurgy or the treatment of the NiTi. Okay. Now, let's use side by side. This is ProTaper Universal and ProTaper Next. So if you can see in this diagram, okay, the ProTaper Universal, the white bars, not the black bars, cause much more crack generation than ProTaper Next. So this is why there are generations of files. Why? Because they changed the file design, they changed the metallurgy. So the use of ProTaper Next as instrumentation is safer regarding possible vertical root propagation. So see, we are not talking now about reciprocation anymore. We are talking about many parameters may affect. And not to mention dehydration. Okay, how about dehydration? The use of sodium hypochlorite, because the time, the concentration, the flow, because we all know that all these factors affect the dentine. Why? Because sodium hypochlorite digests collagen fiber, which consists 23% of dentine. So this is very nice paper. Okay, they mentioned that regardless that dehydration cause cracking of the teeth, regardless of root canal instrumentation. Okay, and if you can see this crack generation in the photo, it's sometimes within seconds. Now, this is very nice paper done by a group of endodontists led by Prof. 𝗏𝗏𝗏𝗏𝗏. He was my supervisor at King's. This is very nice. So they use, okay, rather than using micro CT, they use synchrotron micro CT, okay, which they can shoot in video mode the crack generation during instrumentation. So now they are using rotary NiTi, okay, size 25, taper 8%, okay, which is what? Which is the ProTaper, okay, or wave 1. ProTaper, we're talking about rotation. So this is pre-instrumentation and this is post-instrumentation. You can see there are no crack generation after preparation. This is a single white canal, okay? But now, if they use reciprocation NiTi, size 40, taper 8, with a narrow canal or also wide canal, you can see there are crack generation. These crack generation were not before. Okay? So, is it because of the reciprocation? But we cannot compare because in the rotation, we used size 25. Now we are using size 40. So, let's go back and use same rotary files, okay, which is F2 of ProTaper in narrow canals. And let's see. If you can see here, we have crack generation. These cracks were not found before instrumentation, okay? And this is the crack generation. So again, now it's not only about the motion, it's about to select which file to which canal. It depends also on the canal and your preparation size. Now, as a conclusion, we know we have hierarchy of evidence. Okay, so the top is systematic reviews and meta-analysis, which is the Bible of any evidence. So this is very nice meta-analysis. Okay, systematic review and meta-analysis. They said that our results seem to indicate that the various root canal preparation techniques considered in this study will not cause damage to the dental structure when adequately employed and the proper methodology applied. So crack generation, okay, there are many factors. It's not about reciprocation. It's about choosing which file size, okay, according to the canal, the sequence of the files, you're using single file or multiple files. Is there any path file? How about your irrigation, dehydration, file size, taper, design, metallurgy, heat treatment? All these affects crack generation. It's not about the type of movement. Okay, so nowadays, we are all talk about minimal invasive endodontics. So I don't think there is anyone nowadays use a large tapers, taper 8, like let's say. So we could consider two main things about minimal invasive. First of all, which is taper. Does taper affect the longevity of root canal treated teeth? So this is very nice study. It's the impact of access cavity design and root canal taper on fracture resistance of endodontically treated teeth. They have found that increasing the taper of the root canal preparation can reduce fracture resistance. So the larger taper you use, your tooth or endodontically treated tooth will be more prone to fracture. But the interesting in this study, they found the fracture resistance decreased a lot in taper 8, but there was no significant difference between taper 4 and 6. So both taper 4 and 6, they are safe to be used, but not as a single file. Why? Because again, as I described in the beginning, when you are rotating your file, okay, all the debris will be packed between the flutes, and this will cause stress on the, not only on the file, we will have stress on the canal, and this is why we are having crack formation. Okay. Another point we need to consider is pericervical dentine. This is very important topic because this paper been published in 2010 by Clark and Academy. They proposed the concept of pericervical dentine. Pericervical dentine, they define that it's the dentine adjacent to the cristal bone, okay, which is 4 millimeter above the cristal bone and 4 millimeter below the cristal bone. And you can see the diagrams. So we should be as minimum invasive as possible in these areas, which we call pericervical dentine. Why? Because preserving this area, we will have more fracture resistant. So today file system, we're going to talk about R1 Mini by Fanta. Okay, what is the difference? What is this file system different than any reciprocation file system? First, it's not a single reciprocation system. It's multiple file system or two file system. R1 Mini, the cross section is double S shape, where we will have two active cutting points, which is one of the best cross sections ever in file system. It has high cutting efficiency and more room for debris removal. Okay. Now, it works as a reciprocation movement. So we'll have the main movement in counterclockwise, okay, 150 degree, and then the file will go 30-degree clockwise as a relief or release or to empty the debris. The first file user, which is the orifice opener, usually in other file system, they are very tapered. Their taper is very wide, but if you can see, the maximum diameter at its coronal part is 1.1 millimeter. So it's minimum invasive file, and the file size is 19. Taper 5, variable taperness. It's not a continuous increasing taper. And this file works as continuous rotation, but you have to use it in very low speed, maximum 250. Why? Because of the design, because of the file will get sucked inside the canal, or we will have lock. So always use it in very low speed in rotation movement. Then after that, we'll start with our first preparation file, which is size 17 taper for full working length. The maximum diameter here is 0.8. Imagine 0.8 at the coronal part. I know the taper is taper 4, but it's variable taperness. It's decreasing. Okay, so the maximum is taper 8 at the coronal part. Why? So we will have more room for the debris removal in coronal direction, and this file work in reciprocation movement. Then we will use the second file, which is size 25, taper 6, also variable taperness, and also the maximum diameter is 1.1. So for preserving the tooth structure, so the pericervical tetine is prepared, or our orifice diameter is 1.1 millimeter, which is very, very minimal invasive. Also, this file works in reciprocation movement. Now, the metallurgy being used for this file, Fanta has many types of 𝗙𝗃. They have the AFL, which is flexible. Then they have AFR, which is more flexible, and they have AFH, which is extremely flexible. So the first two files, or the orifice opener and first file, they are AFL, which is flexible. I don't need much flexibility. Okay, but then for the AFR, because we increase the size, the taper, I need more flexible file. So they have used AFR. This is to balance between 𝗬𝗏𝗃𝗧 phase and martensitic phase. Okay, so two file reciprocation system. The main movement is counterclockwise 150, then the relief or release is 30-degree clockwise. It's minimal invasive, preserving tooth structure. It has very high cutting efficiency. Why? Because of the cross section, because of the reciprocation cross section, which is S shape, because of the reciprocation movement, because of the variable taperness and minimum taper at the coronal part. They are very flexible. They have less torsional resistance and safe instrumentation. Why? Because they are reciprocation. Usually, the fracture or separated file incidents, they are much, much less in reciprocation than rotary. This is why they are more safe files, and they are very simple to use. This is a nice case. This is a patient presented, and he has symptomatic irreversible pulpitis in his upper right second premolar. If you can see, this upper right 5 has 2 roots and 2 canals, and you can see they are very minimal invasive. So I need to use a file that offers minimal invasive and effective preparation. So first I have used the first file, rotation, okay, and low speed, okay, for coronal pre-flaring. And if you can see, because of the maximum diameter is 1.1, they remove that much. That's why I was using it as in brushing motion. Okay, I'll try to use as much as possible of the tissue, pulp tissue, in coronal portion, which is a crown down technique. That's why I have repeated it. Then with irrigation, you can see all this pulp tissue being cut by this file, which is very, very nice. Okay, then scouting of the canal with K file 10, make sure I have the right working length, okay? Then I use the first file of R1 mini at reciprocation motion, okay? And if you can see, it goes smoothly inside the canal. It's a very thin file, okay? Minimum invasive file. It goes smoothly inside the canal, okay? And then I'm using the 25 taper 6, also a reciprocation movement. And you can appreciate the amount of debris going in coronal direction. This was not happening with the reciproc or wave 1 because of large taper, but because of the variable taper and minimum taperness, you can see how the debris is going out in coronal direction. Okay, this is after the preparation, and you can see the access opening was minimum invasive, pericervical dentine was preserved, and this is after obturation. And you can see this is the X-ray, how minimum invasive this file system was, and how nice this endodontic treatment was. So take-home messages. Rotary files may cause cracks as reciprocation files. So crack generation is not up to reciprocation file. Only cracks happens due to the instrumentation technique, not due to the type of movement. Okay. Single file instrumentation causes more cracks compared to multiple files instrumentation, regardless type of movement. Okay. Reciprocation files are easier to practice, more safe than rotary files in terms of file separation. So you need to choose your file system according to the case. So it's not about I'm going to use only reciprocation or use only rotary files. Okay, there is no file system that you can treat all cases. It depends on many parameters. Your case, your availability of files, your experience, a lot of things. Okay, so you need to choose your file system according to the case. And for me, I consider choosing rotation or reciprocation is a personal preferences, but you need to follow the guidelines or the you put in your mind that the parameters we discussed. I mean, single file endo, taper, size of the canal, metallurgy, design of the file, all these things you need to put in your mind. So for me, for let's say 7 or 8 years, I don't use any reciprocation. After using this file system and after this information, will I consider this file system? Honestly, yes, because I was thinking that reciprocation cause cracks, but after reading and searching this instrumentation and also with this minimum file system, yeah, definitely I'm going to use this file system. Thank you very much for your watching, and I'm more than happy to receive your questions. And let me check if there are any questions in the chat box. Can you hear me? Hello? Can you hear me? Thank you very much. I will follow the comments, and please, if you have any question, let me know. And also you can contact me through my Facebook or Instagram account. Have a nice day. Take care.